Okay, so we get a lot of people showing up to the office with their blood work with them. They have good-looking results as far as they can see. Not a lot of issues going on, but still they're feeling like this. They're still feeling like a train wreck, but normal blood tests. What do we do about this? How do we address this, or where do we go? Well, we try to take a little bit deeper look, and this seems kind of common sense, but a lot of times it's not happening. We're just like, well, your numbers look good, so we'll follow up in 3 to 6 months and let me know, how you're doing. And it's kind of the rub some dirt on it approach, and I don't really think that's a good way to do it. I think we need to keep looking, look a little deeper. If we're not finding it, then look deeper. Find the answers and look at why. Why are we seeing some of the results we're seeing? Why do we have the symptoms without any kind of acknowledgement or objective measures on some of the blood tests? You got to ask some questions. Are we running the right blood tests? Are we looking at the blood tests with a fine-tooth comb enough to even see some of these patterns that are causing some of these problems? You need to take a closer look. So, fine-tooth comb, we want to look at this a little closer. So typically we have abnormally low values. Those are the pathological values that the labs will look at. We take a little different approach and look at the functional lab ranges, a little tighter, a little more optimal levels, and see if we can catch some of these areas of yellow or cautionary areas and grab things before they become even more of a problem. Here's an example. So TSH is thyroid stimulating hormone, a very common marker looked at for a lot of people, primarily women, but you'll see it in most everybody, men and women. Lab results, very wide range, 0.5 to 5.5. I've seen it anywhere from 0.3 to 6.5. I mean, it just depends on what lab you go to. We take a little tighter look at this, and 1.8 to 3.0, we have kind of come up that it's the ideal range. Even the American Academy of Endocrinologists think 3.0 is really kind of a higher end value, but still the traditional medical approach is that really wide range of 0.5 to 5.5. Crazy thing is, we're still seeing a lot of people even beyond those ranges, but let's catch things earlier, kind of like a dentist would. Let's clean the tooth before it becomes a cavity. Let's not wait till it becomes a cavity and then address it. Let's look at before the fact. Ounce of prevention versus pound of cure is kind of how I like to look at this. So a lot of times, if you're showing up in these cautionary areas, these yellow areas, it'll show up normal and perfectly clean on your lab. We'll take a little closer look at this and see if that's actually an issue. Now, if you're sitting there at 1.7, no problem. If you're sitting there at 0.6, I'd say, yeah, you're getting there close to a problem. You're hanging on by a shoestring. Okay, here's another way to look at it. So you got red light, yellow light, green light. Red light, pathological areas. We have a problem. So we need to address it. We need to address it now, but it's already becoming a full-on disease, if you will, or real problem. Probably not a disease, because we don't know one test means anything by itself. But if we're hanging out here in the yellows, pretty close to that edge, hanging on by a shoestring, let's address it and look at it. Look at all those other factors or all those other markers on your blood tests that are showing maybe there's also kind of leaning towards anemia, but you're not full-on anemic. Well, I'd say, let's treat you as if you are, or at least get you going to where we prevent you from becoming full-on anemic, and then that's causing the fatigue. If you're sitting here just out of optimal range, no big deal. So this isn't meant to be an alarmist or try to make up things or find things that are causing problems. We're not trying to make anything up. We're just trying to spot things early. Prevention as opposed to cure, if you will. So we want to get you in this optimal range, and we want to kind of look at all those blood tests that you're getting and look at them relative to healthy people, not the diseased and sick people. Majority of people going in, this is how they draw up these lab test findings, is they see all the people coming in and getting their blood drawn, and then they look at, okay, the statistical model of if you're outside this certain standard deviation, then you're considered pathological or a problem. If you're inside there, then you're good. Well, I'd say still maybe you're not good, you're not optimal. So we want to look at those optimal ranges and compare you to healthy people as opposed to comparing you to sick people. That's not the way you want to do it. Another way to look at this is like how would a teacher look at this? Okay, we want to compare you to A and B students. I don't want to compare you to F students. If I'm comparing you to F students, it's totally okay to be a low D. If I'm comparing you to A and B students, no, it's not okay to be a D. Let's work on getting yourself to an A or B grade. Seems kind of common sense, but it's not really used that way in the medical model. They're comparing you to F students. Okay, so we want to look at the big picture. This is kind of looking at, are we looking at all of the pieces of the puzzle? Yeah, we'll look at those standard blood tests, but are we looking at any vitamin or mineral insufficiencies? Are we having issues with blood sugar? I tell you what, the blood glucose test is a very poor test. It's only looking at what your blood glucose is doing right here and now. It's not telling you what's doing an hour from now. It's not telling you what's doing 2 hours from now. Now, if you're doing the needle stick and you're doing that throughout the day, yeah, you're getting a much better clue. A better clue, actually, as far as standard blood tests, would be a hemoglobin A1C. That tells you what your blood sugar's been doing over the last 3 months. But they only do that if they think you have diabetes. Well, let's not wait till you have full-on diabetes. Let's catch it early. I see a lot of people with issues, and they're actually in the pre-diabetic state, and no one's even looked at that before. Not good in my book. So we also want to look at dysbiosis, meaning how are the bacteria or the flora in the intestinal tract, how are they doing? Do you have a lot of good bacteria compared to bad bugs in there? Are we looking at hormones? Are we looking at the thyroid hormones? Are we looking at the cortisol hormones? Are we looking at those sex hormones? How do we look at this whole big picture? And then they are all talking to each other. It's not just, well, I'm going to go see the hormone guy today, and then I'll probably go get my blood checked by my GP later, and then my gastroenterologist, he'll take a look at my gut and see what's going on there later. One hand does not know what the other hand is doing, and they're not really communicating very well. So we're also, want to look at the whole big picture and even look at food sensitivities. How is that playing a part? And we can easily do that through blood tests. So we want to look at this and get food sensitivities addressed. We want to normalize the blood sugar. We want to balance the hormones. We want to make sure you have the appropriate amount of vitamins and minerals that create these cascading biochemical events that actually help you create energy and burn your sugars and control all of your metabolic functions. We want to have good intestinal flora. We want that balanced. There's more good bacteria. There's more bacteria in your intestinal tract than you have cells in your body. They are a very vital portion of our humanity, and as far as our health, they play a role with our immune system. They play a role with digestive function. Very important. And then also put that in conjunction with what some of the standard blood tests, and look at those a little more thoroughly. So again, my name is Dr. Chad Miller. I hope this information was a little bit helpful for you. If it was, or if you have any further questions, give us a shout. Our email address, info@cnsrehab.com, or you can give us a call, 402-420-2677. Thanks a lot.